PCOS is very common and it is in fact the leading cause of infertility worldwide. Studies have shown that 1 out of 8 women will have PCOS. PCOS is often dismissed because people who suffer it actually treat symptoms like acne, irregular periods, without addressing the root cause of these symptoms. Now, what is PCOS? Simply put, PCOS is Polycystic Ovarian Syndrome. This happens when the brain and the ovaries do not communicate appropriately. This is characterized by hormonal imbalance, which results in formation of fluid-like sacs in the ovaries called cysts. Symptoms of PCOS may include irregular periods, that is missed, frequent, or no periods at all. Another symptom of PCOS is the first I mentioned, which is infertility. We also have acne that may be very difficult to treat. Hirsutism too is a symptom. Hirsutism is abnormal hair growth. That's male pattern hair growth in the face or in the body. Other symptoms may include obesity or difficulty to lose weight, hair loss or hair thinning too. There is no exact cause for polycystic ovarian syndrome. However, different factors can play a role in this condition. Some of these factors include high androgen levels. Androgens are referred to as male hormones, but to be clear, all females produce these hormones in small quantities. High androgen levels prevents ovulation. This in turn causes development of the cysts in the ovaries and also causes some of the symptoms I mentioned earlier, like hirsutism and acne. Another key factor in the development of PCOS is insulin resistance, particularly in females who are overweight. Insulin resistance is when the body does not respond appropriately to insulin. This naturally causes production of more androgens. Genetics also play a role in development of PCOS. If you have female relatives who have PCOS, you have a likelihood of developing this condition. In terms of diagnosis, your provider will review your symptoms and perform a physical exam. A pelvic exam may be done in order to check for abnormalities in the ovaries like swelling. A pelvic ultrasound may also be ordered to check for cysts in the ovaries and also assess the uterine lining. In addition, blood tests may be ordered to check your hormone levels, including androgen levels. PCOS is diagnosed if you have 2 of the following symptoms. The first one is irregular periods. Physical signs of high androgen levels such as hirsutism or acne. Also, if you have increased levels of androgen in your blood or there is presence of multiple cysts in one or both ovaries. There is no cure for PCOS, but symptoms can be improved with weight loss medication. Losing weight can improve your insulin resistance, regulate your periods, and increase your chances of getting pregnant if that is your goal. Metformin is one of such medications. It is a diabetes medication that is usually administered to reduce insulin resistance, androgen levels, and restart ovulation. Clomidine is also administered to boost ovulation. That's if you're trying to get pregnant. But if you're not trying to get pregnant, hormonal contraceptives can be administered to help reduce androgen levels and also help with other symptoms of PCOS. Now, there's a disclaimer in this video. This is not trying to prescribe, or this is not trying to discourage you from, this is me encouraging you, if you have this condition, to please see a doctor. Or if you have any of the symptoms I mentioned earlier, please see a doctor. And if you have this condition, I'm sending you love and light, and I hope you find this video very helpful. Thanks for watching. Share to your friends. Stop by next time. Before I forget, I have shorts on this channel that tell you what type of food is best suited for this condition. So please do well to check that out. I don't know, I'll link it somewhere in this video, so please look out for that.